Have you ever heard of an ankle fracture? A fracture is a disruption in the continuity of a bone. This is due to trauma like a fall or can be secondary to a disease process such as cancer or osteoporosis. Hello, Mrs. Mills. This is Taylor. She will be your nurse tonight. I'm going to give her report about you. Jane is 72. She was admitted on 2/11/20 for an ankle fracture and possible acute osteomyelitis. Jane fell 2 weeks ago, but is unable to have surgery yet due to a recent PE. She has a history of anemia, hypertension, hyponatremia, chronic bronchitis, sinus congestion, anxiety, and mild confusion. She had a CT scan of the left ankle that showed comminuted distal tib-fib fractures, probably including anterior talar dome fractures, venous Doppler that showed no current DVT, and a CT head brain without contrast that showed no acute intracranial process. The IV is in the right AC and was placed on a mission. She is on a heparin drip of 10 mL per hour. She's alert and oriented ×3 with mild confusion. She is non-weight bearing on her left lower extremity and is not having any pain unless the left lower extremity is moved. There is oxygen running at 4 liters per minute via nasal cannula. Breath sounds are within normal limits except diminished throughout and a non-productive cough. Her vitals today were BP 162/69, pulse 93, temp 98.1, respirations 20, and O2 100. She is in normal sinus rhythm and has no edema. She is on a regular diet and her bowel sounds are hyperactive. She's voiding great and has a PureWick in place. All her extremities are within normal limits except moderately impaired in the left foot. For patient's family, she is sensitive to pain medication, but does well on the doses that she's currently on. She's on IV piggyback vancomycin, 250 per ml per hour. Hang time is 120 minutes and tolerating well. Her white blood cell count was 6.59, hemoglobin 8.0, sodium 134, platelets 167, potassium 4.0. Her UA was negative. Her INR is 1.11, creatinine 0.79, calcium 8.8, BUN 11, and glucose 107. Ortho, vascular, physical therapy, and wound care are on her case. The patient is tentatively scheduled for surgery on 2/13.